Oh, yeah. This, a little bit of that. Will's actually busy getting the coffee. We need a full representation here.
I think they're being modest.
Or shy or something.
Yeah, there's a definite pecking list on who they're making go over there.
Oh, yeah?
I think it's important to note the Memorial High School representation and just room those.
Oh, yeah? No, so who else? A lot of Memorial? Yeah.
I don't think I would, I mean, I'm a lot younger than most of the people here.
Oh,
so
please.
I don't remember if you guys in school with me. I can't recall.
Yeah, but Dan was
He's
in
much
high school
older.
for 6 years.
I thought I'd have a cup of coffee. Everybody else is now putting me to shame because, so first of all, thank you all for taking time to meet with me, and Mayor, thank you for being here too. This is one of the weeks where they send us out of Washington so we can actually talk to people in our districts and kind of touch base about what's going on. So I really wanted to take this opportunity not only to just thank you all for what you do to keep the people of Manchester and greater Manchester and New Hampshire safe, but I also wanted to check in about, in particular, the ongoing impacts that the opioid epidemic is having on the work you do and on you and your colleagues as individuals too. We just passed in December-ish what we call the Support Act, which was a comprehensive bill to try to make sure we were getting more resources to states to fight the opioid epidemic. It's comprehensive in that it deals with both frontline issues as well as the other side of things. How do we build the kind of recovery centers and integrated treatment in an ongoing way that we know we're going to need for years to come. But today what I really wanted to talk about was three things in the bill, or just mention to you three things in the bill that I think are important. Not only did the bill authorize the expenditure of additional dollars for states, so in New Hampshire that's been a total of $46 million additional dollars over a 2-year period, and I know that you all are participating in and helping structure this kind of whole hub and spoke system for addressing the opioid crisis. But when it comes to law enforcement and firefighters and EMTs, we wanted to do a few things in this bill. One was to make sure that there is training for frontline personnel when it comes to dealing with the opioid crisis. Not only making sure everybody knows how to use Narcan, but making sure that frontline personnel are safe and that they have as up-to-date training as they can on substance use disorder and treatments for it and everything that goes along with that. Secondly, the bill has allowed us to crack down on illegal drug diversions. One of the things that you may have heard about is that increasingly it became aware that there are manufacturers and distributors of these drugs who have not been reporting suspicious shipments the way they're supposed to up the chain to DEA. So for some of the issues that we see with the flooding of prescription drugs into various areas, that's been an important aspect of this whole issue. And lastly, we just wanted to make sure that we are doing everything we can to stop the importation of fentanyl to this country. And one of the ways that we all know that fentanyl is coming in is through the U.S. mail. And the U.S. Mail Service has been the one carrier that hasn't had an obligation to track where the shipments are coming from. Other carriers like FedEx do, but U.S. Mail didn't. So we passed the STOP Act as part of this overall bill, and that should make it easier for us to trace where the fentanyl is coming from and crack down on it. We are also pushing the administration to make sure that in its trade negotiations with China, that we are pushing China to crack down on the manufacture and sale of fentanyl, because we know that that's a lot of where it's coming from. So we are trying to do everything we can to give you all the support you need, but I know that talking about this and trying to get you resources is very different than what you all are having to do each and every day on the front lines to address the opioid epidemic and help people who are suffering from it. What I really was hoping to do today, I'll turn it over to the mayor and enjoy any comments you would like to make, but I really wanted to hear from all of you about how we can be more supportive and more helpful. On a personal level, I've talked to enough firefighters, EMTs, and police in New Hampshire to know that you're all incredibly hardworking and you work every day to save lives and keep your communities safe. I've talked to some individuals who have conceded to me, though, that by the time you respond to the same overdose death in a community, you know, or overdose in a community, you know, sometimes ones that result in death, it takes its toll on all of you. And so one of the things I'd like to encourage you to do, if you're comfortable, is make sure that we understand how we can be supporting those of you on the front line with the sheer exhaustion or compassion fatigue that I know is a documented phenomenon, and one that from an individual point of view makes a lot of sense to me that it would be a phenomenon, because you're doing extraordinary things that are very difficult, and you're doing them over and over again at a volume I think none of us ever expected to see. So with that, why don't I turn it over to the mayor. Thank you for all the work you've been doing.
Well, thank you, and you know, it's great to welcome you to Manchester, and I just want to say that we're so grateful for all that you've done in terms of advocating for us in Washington, and it says so much to have you be here with us because the experts are sitting around the table right here, and so you know, I really want them to tell you what they're experiencing, and it will really give you a better perspective of what they're encountering and the challenges that we're encountering, so that you can continue advocating on our behalf. And again, we're grateful for all that you've done.
And thanks. And Chief, maybe I'll, you know, I didn't start by saying thank you for Safe Stations, so thank you for Safe Stations. And it's making an incredible difference. And we know that it's become a national model. It's something that we pointed to during the Support Act deliberations. And again, would welcome comments from you, and then maybe the chief, and then we'll open it up.
Right. Well, thank you very much. And you know, Safe Station is a great program, and it is just part of the solution. We've seen, you know, a lot of death here over the last few years that we've really been tracking it, and we've really been into this crisis. But I really appreciate the fact that the federal government and your office is really taking this on, taking this head on, because you know what, it's really above any community's pay grade. We can't do this by ourselves. Although I think the efforts in Manchester, both the police and the fire line and EMS, were really, you know, making a dent in this, and you're seeing it by the amount of people that, you know, are dying. I think there's a lot of you know, good things, and I think we came together as a community. So those are all good things, but certainly in my 35 years on the job, I've never seen this much, you know, death, and you know, I'm worried about what my firefighters see, and I'm going to a lot of calls with them to make sure that you know, we can do anything we can to support people. We have a lot of education, and that's great to hear that we can really, you know, I think one of the best things we can do here is to really to help our guys understand what this disease of addiction is and why people are coming here. You know, we've had 53 people come through our doors looking for help, and you know, no one chooses to be you know, an addict, or so we're doing our best. You know, despite some of the hurdles we've been going through, but now we're at, you know, Safe Station 7.0, where I think we have a good process going here. I don't think a week goes by where we're not sharing this process with other cities and towns all across the country. we're all over the place now, and we'd like to share that skill. We're doing some good work there. But it really is. I'm very proud of my firefighters and my city and my police officers and my EMS workers, because we really are on the front lines, and we're seeing a lot of stuff that I didn't see when I was growing up in the business.
Anything you'd like to
Yeah,
add?
so first of all, thank you. We can't, from the police department, the support that your office has given the mayor's office, it's just been tremendous. Much like what Chief Noonan is saying, our biggest concern is for the Manchester Police Department, 80% of our patrol have under 5 years on, so we're a really young department right now. The amount of death that these young officers are seeing is just tremendous. So it's really, we look out for the well-being of our officers. You hit the nail on the head with the compassion fatigue. We absolutely see that. These officers are responding to just a tremendous amount of calls with fire and EMS, and it's just, we have to really look out for their well-being. That's my biggest concern from our agency's perspective. We obviously are going to respond, we're going to do our job, we're going to help the community, and our ultimate job is to protect people and save lives.
Right.
And we're going to do that every day, but on the same time, we really have to focus on our staff and make sure that they're doing okay.
Yeah, yeah. You want to add anything, or?
Yeah, I mean, I would just echo what Chief Capano and Chief Coonan said. Our paramedics and EMTs in both Nashua and Manchester are on the front lines every day. They see a tremendous amount of sad cases that are out there. And it worries me when I go home that I think of these folks and the things that they're seeing, the things that they're doing. We did have one of our employees who committed suicide in December. And that's something that hit home very hard on
I'm
us.
so sorry.
And we want to make sure that there are services available to folks. Some folks want it, some folks don't.
Right.
We get that.
Yeah.
But we have to police ourselves and make sure that the people that we see in need of help are getting.
So I'll open it up to this side of the table. Anybody?
I think, as far as compassion fatigue goes, it's very accurate, and I think at least on the fire side, we traditionally, we're a pretty thick-skinned group of people, and firefighters in general are problem solvers. There aren't many things you call the fire department for and we can't fix it.
Right.
But this particular crisis, we sometimes, you say, I don't know. This is something we don't have an answer for, which is frustrating. And it used to be, even a few years ago, everybody still has the wrong image of a heroin addict, that's a guy in an alley, a homeless person behind a dumpster. But we've all been to as many overdoses in a $1 million house with good families that did everything right.
Right.
And there's no, I think we start to get frightened for our own kids. I mean, I
Right.
have 3 kids under 13, and I'm worried about them.
Sure.
I mean, there's, we kind of came up through the fire service as, you don't want to do drugs, don't do drugs, that's how it is.
Yeah.
Like, how can you choose to put
Right.
that in you?
Yeah.
And now we've seen the medical change and the mental change that an addict goes through, and I think we're frustrated because
Yeah.
we don't have something in our bag that can fix you.
Yeah.
Well,
Well, and I don't know if this is helpful or not, but I will just say that part of the reason we know now that so many people have become addicted is because of deceptive and misleading behavior by large pharmaceutical companies who just wanted to sell opioids. And that then meant that as prescription drugs would dry up for people who had gotten addicted because of the sales practices of Big Pharma, and I shouldn't say all of Big Pharma, but a number of companies, that cartels targeted places like New Hampshire that had a high level of prescribing. And I say that because I think it's really important for you all to know that the other prong of this battle that's being fought right now are lawsuits in state after state after state, with a lot of also attention now on the federal level to hold these guys accountable and try to get us resources. That doesn't change your day-to-day, I know, but I want you to understand that we know that this didn't happen by accident. It really happened because of a concerted decision by a couple of drug companies to flood the market and keep people prescribing. And that understanding is really important for all of us as we look at people with the disorder now too, because a lot of them were taking a drug that they thought was okay because the doctor prescribed it for them. And this understanding about how it just changes the wiring of somebody's brain is incredibly important for all of us, but I just want you to know that we're trying to hold the people accountable who are responsible for this, one, because it's a matter of justice, but two, because they should be sharing in the responsibility and the cost of treating people and turning the tide on this epidemic, and we're going to keep pushing till we do that.
I think, you know, like Chief said, you know, it's a totally different job now.
Yeah.
You know, when we got on a long, long time ago, you know, if we had one of these once a week,
right,
and you talk about it for a month, now you do a dozen of them a day.
Right.
But I think the good thing that's come out of this is that, you know, when it first started, the impact, and then it was kind of like dropped in our laps. And again, we're fixers. Yeah. From the police to EMS to us, you know, and the frustrating thing is when, again, like Chief Burns says, when you, geez, I don't have any answer for this. But what has come out, the good thing that's come out, you know, that I feel is that between the police, fire, and EMS, we gel together. We get on a scene now. Yeah. They're taking care of us, and we're taking care of them. You know, it's just, we go in together, we do it, and we come out together. Yeah. You know, so there is some positive stuff.
I certainly, you know, when I did the ride-along, which I think was last April, I certainly, at a couple of overdose scenes, saw you all marshaling together, you know, and really working together, which was incredibly impressive. And I know saved lives too, but so I'm glad to hear that piece of it, if there's a bit of a...
It's crazy. You never know what you're walking into.
Yeah.
And, you know, it's you just go in together and you come out together. So.
Yeah, that's a good way to think about it.
I think some of the problem too is, you know, as a busy city fire department, these guys do thousands of runs a year. Yeah. And this epidemic just puts another layer on that, you know, that emotional toll it takes. So I know the focus is on the epidemic, but these guys have, you know, the captain here has got years of past, I wouldn't say mental trauma, but you have other incidents, so you just throw another little layer on it like an onion. Right. And you just deal with it and just move on, and in a matter of time, it's just kind of go ahead, and that's another thing we're gonna fix.
Yeah,
So.
yeah. Well, I think, you know, understanding, but first of all, I think it's really important and impressive that you all are talking about it and identifying it, because I think, you know, in my experience, all of the agencies represented here are the ones all of the civilian world calls and says everything from my cat won't come down the tree to there's a funny odor in my house, you know, to there's a fire, right? And so I think it's just incredibly impressive that you guys are acknowledging this. What I think I'd like to know is if you could choose a kind of a protocol for your own needs as you deal with this on the front line. If it's a matter of needing to be able to talk to somebody with expertise and compassion fatigue and treating people who are doing what you do, what would that resource look like? How often would you like somebody available? How many people do you think a department the size of Manchester or a community the size of Manchester needs? How could we get resources to you guys that could, and to your families, which is the other group I haven't talked about yet, which is I can't imagine that any of this is easy on your families either. So, yeah, go ahead.
You don't want to. I speak to you as a veteran, probably some other veterans in the room, right? The military tactics problem, post 9/11, Afghanistan, Iraq, combat fatigue. I think we need to look at this from a perspective of what are we doing for the force? Yeah. For his people, What kind of resiliency training are we offering? The Chief and I have kind of talked about this, right? The military was looking at, what, 22 suicides a day? I
Yep.
believe, Senator, was kind of the statistic they throw around.
Yeah, it's about 20 a day right now.
Okay.
Yep.
You know, in the military, we attack this from, okay, let's do quarterly, monthly resiliency training, at least mandate some type of
Right.
training, right? But that costs money.
Right.
Okay. I'm not trying to, you know, we throw a lot of money at the victims of the overdoses
Yeah.
through Greater Manchester Mental Health,
Sure.
pathways, you name it.
Yeah.
Can any of this money be used for the force?
Right.
And actually identify legitimate, there's a lot of resources out there that do resiliency training for military, fire, police. I think we need to attack it as all three services here. Let's get together and put a lot of time, it's gonna cost money like anything
Yeah.
else, but I think if we start offering some type of resiliency training to the force, I think you may see a better reaction in regards to firefighters, EMTs, police
Yeah.
officers actually raising their hand and saying, yeah, I need to talk to someone.
Yeah.
You know, we have stuff internally
Right.
that we do as a police department, but I think we need to make it more structured
Right.
and more frequent
Right.
that we offer this training. But we all struggle with budgets.
Yeah.
And the
Yeah.
mayor, you know, that's the way we, because God forbid, you know, you mentioned suicide, right? One of our firefighters or our police officers commits suicide, and that's a game changer.
Yeah.
And I'd like to see us get out in front of that before it. And I've experienced that in the military.
Yeah.
And have had soldiers that have committed suicide, and we all sit back and go, oh, what did we miss?
Right.
You know?
So making it the norm by having some real investment in it and structuring it also makes it easier for people to access without having to feel like they're stepping forward or
Right.
asking for something special.
I've known countless soldiers that their lives have been saved because of resiliency training.
Yeah.
And they're given even if they had a phone number that they walked away with.
Right.
And they make that call.
Yeah.
And now we take care of the force.
Right. Right.
If we don't take care of, you know, the force, then we're gonna have a big problem.
Yeah.
And equally, just families have to get this training as well, because we all go home to wife, children, and if you're dragging a lot of this home with you,
Right.
that's going to affect your home life. Your home life, we've seen it 100 times in our line of work, that affects your work life. And if we're not on our A game every single time we go out on the street, much like EMS and the fire,
Yeah.
that's when one of us is going to get hurt,
Right.
or we're not going to be able to provide the services that we need to.
Yeah.
So it's equally important to get that type of training to our families as well.
Well, what I can take back, you know, from this is, we will go back to look at the way the funding is authorized right now and begin analyzing whether we need to do something additional or whether it's something we could access if we structure it right. So, thank you for the differentiating it a little bit.
That would be great.
Yeah.
And when you look at that
Yeah.
funding, if it can come directly to the local communities,
Right.
because the needs are different in each local community
Sure.
versus just when it goes to the state level, it tends to be
Yeah.
divvied out equally.
Yeah. No,
That
under-
would be great.
You know, one of the big battles that Senator Shaheen and I had, which I'm happy to say, you know, we were successful in waging, was trying to get the federal government to understand that every state is different and that we had a higher per capita death rate than a lot of other states that were actually getting a lot more money because of the unique fentanyl saturation that we have here. And so your argument back is exactly right, which is we should be talking with localities about what specifically they need. And then we should also, I think, always allow localities to partner up where it makes sense,
Absolutely.
especially some of our smaller communities where you can get a little bit of an advantage from volume, right? But-
Yes.
And if I could add,
Yeah.
when you talk about, you know, where these funds are going or how they can be used, one of the issues we have with how, like say the SOAR money came down,
Yeah.
there was $43 million there, and that was great, but it's what can you use that for?
Right.
So what we're seeing here is, and the chief will tell you, we're seeing, you know, not just opiates, we're seeing methamphetamines
Right.
and alcohol and everything and all of the above.
Right.
So some of this money can only be used for opiates, or actually, I think most of the money can be used for opiates. So we have people coming in, and we don't ask what their drug, you know, we
Right.
ask what their drug of choice is, but we let, you know,
Right.
we're treating everybody.
Right.
And we're trying to individually get the best treatment for that individual. Now, if someone comes in with a methamphetamine addiction, we're like, sorry, we can't use some of this money for this, so what are we gonna do with
Okay,
him?
all right.
And if we started to, and I talked to Senator D'Alessandro, and he was saying, hey, Chief, we're forgetting about alcohol. And if we started tracking alcohol, we'd double our numbers.
Yeah.
So it's a substance use disorder,
Right.
whether it's an opiate or anything else. So that's one of the issues that I think we're having, because we get kind of pigeonholed into opiates, and as the chief is going to tell you, we're waiting for that tsunami of methamphetamines.
Right, which some other states are seeing. We just had a hearing last week, I think it was, and some of the western states, senators, Montana, Wyoming, were sounding an alarm on their meth epidemic, which I hadn't realized had hit their part of the country as distinctly as I guess it has. And so that's another question we will take back and look at, because certainly other legislators are beginning to raise the same issue, which is, the other thing we know about the cartel side of things is, as you begin to crack down on one thing, they're going to move to something else.
We're definitely seeing the increase in meth out here, for
Okay.
sure. And you're absolutely right, it is a business model. If anybody thinks this is not a business being
Yeah.
run to make money and generate money, it absolutely is. They're gonna shift, and they're gonna do whatever they have to do to keep pushing things this way.
Right.
As long as you have people willing to buy it, they're gonna keep sending it, and they'll make adjustments that
Right.
need to be made to continue making that type of money.
Yeah.
And Chief Noonan's absolutely right. When we get some of the funding that we have, it's very specific that you can only go out and target an opioid. I can tell you from our drug unit's perspective, every time we hit a house or we arrest somebody, they have every different drug you can imagine, from powdered cocaine to crack to heroin, which there is no true heroin really
Right.
anymore. It's all fentanyl and marijuana. These are all things that we're finding in every single house. Meth.
Okay.
It's never just one product.
Yeah, okay,
So that really handcuffs us a little bit as far as trying to actually do the job that we need to do.
okay.
And we see that when people are coming in, and I talk to hundreds of people that come in through the Safe Station program, and I'll ask them it's simple to ask, what's your drug of choice? Well, it's fentanyl. But what do you use? What do you use? I used all the above, and there's a lot of meth out here, Chief.
Yeah.
And so, when we first started this program, people came in and it's like, oh God, this heroin problem. Someone came in for alcohol, it's like, hey, God, it's an old-fashioned alcoholic.
Yeah,
Now
yeah.
I'm saying, oh my God, it's a good old-fashioned fentanyl addict, because we can help you with
Right,
that with
right.
medication.
Right.
Meth is the scariest thing.
The
that
scariest
we
thing
should
around.
see. Not from a safety perspective for everybody in the room. because
Right.
those
Just the
people-
aggression.
Yeah. those
Yeah.
people,
We
you
see
can't reverse on
really
narcan.
desperately ill human beings come through this that are at their absolute lowest point, and we're trying to give them a shot at treatment. So.
And where are people getting the meth? Because I understand, it used to be kind of home, one-off labs, but that it's more professionalized now. That,
We're seeing shipments coming from out west.
okay, all right.
Yep. That's where we're seeing it from. It's like you think of the one pot
Right.
meth in a house. You're not really seeing that anymore. You can now access it and get it shipped here. And that's what we're seeing. We work quite a bit with U.S. Postal and
Right.
some of the other agencies out there for shipping, so we got notified with that. But absolutely increase with that.
Can we go back to the topic for a second of families? Are we doing any outreach to your families as they're supporting all of you on the front lines?
I'll give you an honest
Yeah.
answer with that, no.
Okay,
No.
that's
you
what
know,
I thought,
We
yeah,
always tell them that we're available if you need anything.
yeah,
But to actually set up a training and offer that to
Right.
them, I can tell you the Manchester Police Department, we have not. We've talked about that recently with some resiliency training.
okay,
I know that state police has put on a program recently, and they do one day
yeah,
with the troopers, and then another day is offered to the families. And we actually had been discussing this and looking into it. We're currently looking into it now, but it's one of those things where you want the officer to volunteer to go to this training.
right,
You want the families to volunteer.
Right.
It's easy for me as a chief, I can just make it mandatory for these officers,
yeah,
but obviously funding comes into play.
yeah,
But I can't make it mandatory for a family. But
Right.
I think it's equally as important to get the family in there as it is for the officers.
I think the only training that our families are getting are from us.
right,
Yeah.
Like these guys, I have 2 young kids at home, and I don't hold a a lot back, you know.
Yeah.
They're at that age where, you know, they're influenced by a lot of things, and, you know, I sugarcoated a little bit, but
Yeah.
they know, they get the message, you know. I talk to them every time I come home from work.
Yeah.
You know, my daughter always asks how many sick people yesterday, Dad.
Right.
You know.
Yeah, that's a tough question to answer every day. But it's also, you know, as I understand some of the challenges at home that can be caused by some level of compassion fatigue is everything from just being short-tempered to, you know, all the ways
All
we
of the
deal
above.
with stress that
Yeah.
our kids don't necessarily understand as anything other than mom or dad just snapped at me and what did I do? And so I'm asking the question just because I think the communities you serve value what you do incredibly. I think they don't always remember the impact it has on families. And I think we need to do a better job as policymakers of trying to figure out ways we can invite families to participate if they want to, have more than one pathway of asking for assistance. And, you know, I just want to let you all know that it's something I want to continue to work on and happy to talk to people about, and so is my staff at any time. But, you know, you've given me some ideas for places to go look, you know, in terms of our funding packages to see what we might be able to adjust, or if there are other grant streams out there that might be able to be of assistance.
I think there's two things that aren't really being touched upon.
Yeah.
From I'm a firefighter.
Yep.
Not an officer. A lot of these guys are firefighters. So I can't speak for them, but one thing that's not really talked about that often is when we go to this individual's house
Right.
multiple times
Yep.
for the mom,
Right.
legitimately an hour later going back for the dad.
Yeah.
We know what's going to happen when they go to the hospital. They'll walk out.
Right.
Now, I'm not talking safe station, I'm in real life.
Yeah.
They're going back to the house.
Right.
But what a lot of people are leaving out are the 2-year-old that's playing with that empty bag,
Yeah.
the 12-year-old who's smart enough to know what the hell's going on.
Yeah.
They're involved.
Yeah.
So what happens, they can, I mean, the police are with us as well,
Yeah.
and the EMTs. But when we go into the house and we're dealing with dad and then we're dealing with mom, it's a cycle. No one really talks about the kids.
Right.
Because they're all there.
Yeah.
And then they're going to school.
Right.
In the Manchester school system, and the teachers have to deal with them.
Yep.
That's a big cycle as well.
Yeah.
It's not talked about that often in real life.
Right, and I thank you for raising it. And there are some models in a couple of different school districts, like Laconia has some federal funding where they're really trying to address the impact on kids in
Right.
particular, and have had some really tragic situations where they've had to deal with children whose parents have died, you know, in front of them, right?
From our standpoint, and I can't speak on the actual laws of
Yeah.
what the police can and can't do. We just
Right.
see them on calls with us, but there's not really much we can do.
Right.
We'll go there, and it happens more often than you think. We'll hang out with the mom, let's say,
Yeah.
conversation say, and we take her. We're aware, we're looking at the dad, we're aware something's going on with him.
Right,
Our hands are tied. We can't
okay,
do anything.
okay,
Same with the police.
okay.
So we're leaving there, and I've said to my officer more than once, I'm like, this is just not kosher.
Yeah, this is not,
So then the police get involved, but it's that we have to leave the building, and then we know we're leaving
yeah,
that other parent with the 5-year-old.
yeah, I get
And
you.
we've been to numerous calls where the mom and dad both are lights out,
Yeah.
with the 5-year-old, the 6-year-old, whatever, hanging out on the couch watching TV.
Yeah. And how,
That's an issue.
yeah, how quickly can we get children and family services?
We, from the Manchester Police Department, Corey is talking about, he's absolutely right.
Right.
So when we get in there, it's a situation of neglect. We'll handle it from our end as
Right.
far as any appropriate type of charges. We have at the Manchester Police Department, the ACER team.
Right,
So they go out there and they'll try to tackle that exact situation where if they come across any children in the house, and it's not just children that are observing trauma,
Right.
as far as assaults and things of that nature. It is those kids that are seeing the parents overdose. then we'll circle back around. A police officer will go with some services, and we'll circle back, and we'll get authorization to go back again, and then we continue to check up on these
Yeah.
kids. It's become an incredible program with the police department.
Yeah, the ACER program is becoming a national model, as you know, but I also can imagine that even if you know that exists,
Right.
leaving a place where you know there are two kids and you haven't been able to get back to the earlier theme, you
Right.
guys are fixers, you take care of
And
people.
then it turns into the whole, in the inner city, we know a lot of the addresses off the top of our heads.
Right.
So when we're going back to that building, and again, I can't speak,
Yeah,
I'll speak on this one just for me, but the sympathy
right,
for these individuals,
right, I hear you,
zero.
yeah,
Because it's just, we see it every day.
right,
And then knowing we're gonna go to this house where there's kids involved,
right,
and where's the needle now, where's the baggie now, I don't know.
yeah,
You know, where it went.
Yeah.
And it's the sympathy level for some of them, not all, but a few of the clients are,
I can,
yeah.
I think a lot of us can try to relate to that,
Right.
for sure. And you know, the impact on children long-term and families, you know, the other part of this that I've been focused on, and part of what this overall comprehensive bill is trying to address too, is we now have grandparents raising their
Yeah,
grandchildren.
I was just gonna
and-
say,
and
the
it's-
majority of the kids in this neighborhood
Yeah.
are being raised by their grandparents.
Which just, again, poses a whole lot of new challenges. You know, I have met so many grandparents who are absolutely, you know, just doing right by their grandchildren, but they're using their entire retirement savings to do it, you know, to the degree they had retirement savings, right? And they are not living, you know, the life they thought they would be at this stage in their lives, and that creates a whole lot of issues for the kids, for the grandparents, for the schools. But to your point about seeing this cycle of behavior and understanding that it's ongoing, and the drain that is on all of you on the front lines.
Yeah, it's
It's a
nonstop.
really, it's nonstop, and it's relentless, right?
And I think of us in the field, the children far away the deaths we see. When we go to these families where there's, you know, 2 and a 4-year-old, and they're
Yeah.
watching Paw Patrol while dad's over eating the couch.
Yeah.
My kids watch Paw Patrol, but they're just eating snacks, having fun.
Yeah,
These kids are doing it just to be distracted, so
Right.
so the parents can shoot up.
right,
That's what it gets us, I think.
Yeah.
It wasn't the deaths, it was
I-
the kids that don't have a
yeah.
chance,
yeah, yeah.
you know?
That's heartbreaking.
It is totally heartbreaking. The positive news is that the ACER team is trying to figure out, you know, trying to really break the cycle for those kids as effectively as we can, but I know without asking that we don't have the resources we need.
I can tell you another positive thing about the ACER team. I sat down with the
Yeah.
ACER team. They have a grant that they just got, and we're going to be part of the ACER team. So we're going to be working with the police officers to identify these families that are in this dire need and try to connect them as quickly as possible, because one of the things they notice is that we, you know, the police department don't go to all the calls. I mean, we go to calls, you know, not just heroin overdoses, but we go to all kinds of calls. And we
Right.
see these types of things. We do make a lot of referrals to DCYF. So one of the ideas that they had was, hey, why can't we have the fire department help us with this? And we're all in, and you know, like I said, this is really needs to be an all hands on deck effort. But we do see this thing as Corey says, this is a generational thing. I've been here
Yeah.
for 35 years, and I've seen
Yeah.
it. You know, I've seen people come in, and you know, you see a 19-year-old kid that says, you know, Chief, I've been addicted my whole life. I'm like, how the heck? What do you mean you've been addicted? Well, I was a heroin baby. So you see those
Right.
generational
Right.
things, you know, and you know,
Right.
you see 10-year-olds doing CPR on their parents, and then, you know, next thing you know, you see these people having their Cheerios, and you're like, well, this is their normal day, and then we can have the schools answer, you know, handle this.
Yeah.
So it's you know, we found this, you know, we started, yeah, I remember, you know, I'm gonna stay in my lane. This has become a super highway, so there's so many
Yeah.
issues out there that we have to deal with. But it's great just to have, you know, to have a senator here that is so involved.
Well, I thank you for that, but the metaphor you just used, stay in your lane, but now we're in a super highway, is a really important one. And I think one of the things policymakers need to do is really address the need for integrated responses and an attack on the problem. And that's, we made some progress towards that in the support bill, but there are some places in the country that haven't been as hard hit as we've been. Every place in the country is dealing with it at some level. And one of the things that's very helpful about this conversation is it gives me examples to take back to the full team of senators on the Health Committee, for instance, and on the Finance Committee who address this, not to mention Homeland Security, because there's another piece to this. You know, how do we address the flow of drugs over the border, and how do we do it in as smart and effective way as possible? But being able to talk to people about the ripple effect here, and that we have to address this crisis for what it is, which means from all angles, and everybody has to be willing to work together. And you know, one of the bigger issues that we're going to have generationally is we need a workforce that can help when people are interested in treatment and recovery, and we have to give you guys the resources so that when somebody comes to Safe Stations and wants help, there's somebody right there. You know, the handoff is immediate, right? And that we still don't have enough workforce, whether it's for treatment and recovery for people with addiction, or whether it's for people who are going to help these kids who have grown up in this world. So we've got work to do.
Chief makes a great point. You can walk into one of these homes and there's 3 kids there, and you go traipsing through with 6
Yeah.
firefighters and 3 paramedics and 2 police officers. They think that's absolutely normal.
Yeah.
They are watching TV, eating their
Oh, poor
Cheerios, hi guys, and you leave and let them
Wow.
go.
Yeah.
And somehow we gotta figure out how to let them know that that's not normal.
Normal, right.
You know, that's not how it should be.
Yeah.
Or to have an 11-year-old tell me that's the second time they performed CPR on their parent. That's heartbreaking to hear
That's
that.
totally heartbreaking. I am so sorry.
Yeah, that
Yeah.
they know what to do, you know, at this age.
Yeah.
One of the other things that can be frustrating is, you know, anybody that comes to the door, you can't turn them away.
Right.
And we have repeat customers,
Yeah.
and we call and we go through the procedure, and, you know, they'll go to Granite Pathways, then they'll go to Farnham, and then a Friday night at 11 o'clock, you'll get parents that have traveled down from anywhere with their 22-year-old child, grown-up child, and they say, listen, we can't take it anymore.
Yeah.
You know, the child has stolen everything from
Right.
us, meaning hundreds of thousands
Right.
of dollars, jewelry, this, that, we just can't do it anymore. Then we make the phone calls and they say, sorry, we have no beds till
Right.
Monday.
Right.
What do you tell these parents? Now it's
Right.
on us.
Right.
You know, and you're like, oh, man, and you're trying to find, and if you can't find anything, you know, you're heartbroken because you got to say, listen, can you just keep them for 2 more nights? No.
Yeah.
No, we're
Right.
done.
Right.
We're done.
Right.
And we don't know what to do,
Right. Right.
you know?
Yeah.
It's heartbreaking on us
Yeah.
because you see the parents, they're all of us.
Right.
We worked hard, you know,
Yeah.
and never mind the emotional, you know, letdown that you're going through because of your child, you know, and it's just,
Yeah.
yeah, it's crazy.
Yeah. Getting to the point where you have to, in a way, give up on your own child, which is something that
Yeah.
doesn't come naturally
Yeah.
to parents. And, well, and that speaks to the need for more resources and more flexibility, and resources in more places. So one of the things we're trying to do is make it easier for people in the full scope and range of medical practice to get qualified to treat, but also thinking through what a full, robust workforce to deal with a generational epidemic is going to look like. So I, you know, again, having you all describe particular situations really helps me, because I can, the biggest part of my job is to take what can be philosophical debates and boil it down to what's happening on the ground to people, and then see how we're going to move forward to make it better. And again, it's not, you know, what we have all been saying who have been part of the response to this epidemic for a long time is we know it's not going to get fixed overnight, but there are things we can do to be better in our response and make progress and take some of the pressure off of those of you on the front lines.
If I could pick up on what Pete said,
Yeah.
with the funding that came in and the governor put forward a plan of hub and spoke. So
Right.
he set up hubs throughout
Right.
the state, which was great. But what we're seeing now is that the spokes in other areas are not there.
Right.
So we're still getting people
still
to
getting-
Manchester from another community, which is causing stress on our,
Right.
police, fire, EMS, and community. So if the focus could be on making sure those services are available in the home territories where the hubs
Right.
are, that would be really beneficial
Yeah.
to everybody involved.
Yeah. And that goes, again, workforce and
Yes.
distribution, yeah, and training. Yep.
Because we hear it all the time, you know, like, where'd you come from? Berlin. Okay,
Right.
what happened? Well, we were at one of the hospitals and they told us to come down here.
Yeah,
You know, where were you? I was in Salem. They
Right.
told us to come here. They told us to come here.
Okay.
And again, we're never going to turn anybody
Right.
Yeah,
away.
and it
You know.
you
talks
guys
to
are
the
saving
success.
lives for everybody, and that's
Yes.
great, but there are things we can do. Right.
The success of Safe Station is sitting before you.
Yeah.
You know, and that it's available 24 hours a day, and it's access-free, and our, public safety officials treat individuals with respect, which we've heard time and time again, is a reason that people understand and feel comfortable coming through Safe Station, and that we can get them the help that they need. And it's a time where maybe we should think about rolling that out in other areas
Yeah.
throughout the state
Yeah.
even.
Yeah. In some parts of the state, not all of the ones that are still referring people here, part of that is helping them with some greater infrastructure.
Yes.
You've got a lot of very small towns with volunteer fire departments. So we got to figure out a way to give them enough infrastructure and spokes to be effective. Anything else?
I gotta
Yeah.
say, it's
Yeah.
actually, I've been biting my tongue. There's every single one of us could give you literally 200 stories.
Yeah.
No one wants to hear war stories, they're boring, I get it. But I feel like when you leave here, you need a real life picture
Yeah.
on what goes on here. I'll give you the super cliff notes.
Yeah.
Went on a call by Central High School, showed up, the dad went to Elliott for spice,
Yep,
smoking spice.
okay,
The mom was 38 weeks pregnant, went to CMC for an OD. The daughter, who's 7, her name was Abigail, she's in the house. And it was me and my crew, and we're
Yeah.
like, well, Mom, who's watching the 7-year-old? She's all set, my friend's watching her. The friend was there. The friend, we know her, she's a known prostitute.
right,
So I said to my officer, I'm like, no.
yeah,
We threw in the fire truck. We brought the 7-year-old with the ALS to CMC. We do our thing, we leave. 2 weeks later, I'm driving. The chief was my officer for this call. Call came in. I knew the address. I go, at the time he was my captain. I go, hey, Cap, this is where we're going. This is what happened 2 weeks ago, blah,
Yeah.
blah, blah. So we show up. The mom's there. The father's there. The 7-year-old's there. She remembered me. Their friend was on the floor, lights out. We didn't
Right.
get him back. So now we turn into, we're there for a little while now.
yeah,
Come out, the girl's talking to me, the mom's talking to me. And so I knew the answer to this question, and I said, hey, how's your baby doing? Oh, good and stuff. No, that's a lie. Because when ALS brought her to CMC,
Right.
the baby, so now I'm like, so how are you and your husband still here with a 7-year-old with your friend who's dead on the floor?
right.
That's real life. That's
Yeah.
what we see it
No,
every day.
and that's,
That might be a drastic one. That was a little hot. That hit home a little bit, but
that's okay.
that, all these guys, that's
Yeah.
the real life story.
Right.
Is what we see every day. It's
Yeah.
different when you read it on paper,
You bet.
but when you see it, or
Yeah.
when you hear from the guys that are there, seeing it in real life, and
Or when you
That's
hear,
right.
when you hear a 7-year-old's voice,
right.
right,
That turned into Manchester police got involved. He said where the little girl was taken out of the house because the officers did the reports
Right,
and
right.
the right people know. But that stuff,
yeah,
that's 2 blocks from Central High School.
yeah, yeah.
It's outrageous.
It is outrageous, and trying to address both the outrage
Right,
and the human beings in the middle of it
right.
is the hardest single public policy thing I've ever dealt with, which is not an excuse for not doing a better job
No,
at
I
it,
get it.
but no, look, I mean, but the most important thing that, you know, I can do is hear those stories.
Right.
And, you know, it's probably time for me to go on another ride-along or two. I haven't been on one for about a year. You know, it was very helpful to me last year. I think in my first hour and a half with the officer, we went to, what, 4 overdoses? And that was, you know, I could see it, right? As opposed to your point, I would get this, I get the statistics every month, right? But that doesn't talk to me about all of the interactions that you're seeing, the children that don't make it up in the statistics. I don't get, you know, we don't cover it the way you guys are seeing it. And that's, not just seeing, experiencing in a lot of different ways, right? And carrying with you all the time.
Right.
And so I thank you for, I thank you for that, because it's
And
really
I'm not,
helpful.
any of these guys,
Yeah.
same with the police, same
Yeah.
stories.
Yeah.
It's not stuff, but
Yeah.
just,
No.
This is the superhighway we're talking about. This
Yeah.
is the tentacles of this crisis. This is, you know, it's not just, it's what we see. It's the damage it does to us. It's the damage it does to those families, those kids, the schools. So it's bigger than just this simple, you know, hey, these are just desperately sick human beings, and
Yeah.
figure out, and they're going to have desperately sick kids, and we're going to see them again. It's
Right.
a really terrible thing.
It's a 2-generation issue. And
And it's
that's-
hard for someone that doesn't travel that superhighway to
Yeah.
understand it.
Right.
Because you can't even, in your wildest dreams, imagine.
well,
some
they
cases.
think you're being sarcastic or exaggerating stories.
Right.
Yeah.
No.
My wife still thinks some of the things I tell her after 29 years when I come home is, oh, really? Did that really happen?
Yeah,
It did.
it really does.
And it's something you can't arrest your way out of, so.
Well, and that's what you all have led on. You know, so I want to circle back, and I'll be around for a little bit after we conclude, but I also, you know, you guys have given me a ton of time already. But it has been law enforcement, public safety, people on the front lines of this crisis who have been very clear about both the outrage piece of this, which is absolutely legitimate, but also the understanding that we're not going to arrest our way out of this. So we got to figure out that combination of holding people accountable and getting treatment to people and sustaining this over the long term. Because the other thing I'm learning when I talk to people who are in recovery is that a lot of them have gotten into long-term recovery only after they've failed a bunch of times. Which is one of the things you know, if there were one thing that I wish we understood the science of better, and we're, you know, the federal government is doing some research around this whole issue of addiction, but I wish we understood the science of how you make that first intervention for recovery more effective. Because I have friends whose siblings have, you know, failed recovery multiple times, and the whole family thinks they're better, and then they're not. And we got to figure out how to make it count the first time for everybody's sake. I just want to end by just saying thank you. You all are extraordinary. You have been national leaders on something I'm sure you never wanted to lead on. You know, I never expected to become a governor and a senator and become somewhat expert in the opioid epidemic. But it is here, and it is devastating our state. And you guys have been leading the way out, so I thank you. I know it doesn't feel like there's out yet. And I wish I could tell you that we could, you know, come up with a magic cure and it would all be better immediately, and I think we all know that won't happen. But I am honored to have you all as partners in this, and we'll do our best to move forward and get you more of the resources you need. So thank you so much.